So welcome to another webinar today. My name is Laura Griffith and I work in the public health team at Birmingham City Council. So today I want to introduce a Bolder Healthier Winter. So it's a series of practical resources to enable community leaders and professionals to support communities in Birmingham stay healthy and well this winter. So you can find lots of other recordings on the website, and there is more to come as well. So this week we'll be covering sleep and looking at how some common sleep problems people experience during the live course, and also look at some strategies for looking after your sleep so that you can get better sleep and increase your health as well. Think about, well, why should we care about our sleep? So we spend a lot of our lives asleep, yet most of us don't even think about it too much. We spend up to a third of our lives asleep. So sleep will have changed for you across your life in terms of how much you get, the quality of it, and how easy it is for you to fall asleep. Typically, babies sleep for longer periods, but in shorter sleep cycles, so they wake regularly for comfort and milk. And there's actually a growing global trend for sleeping shorter periods, and actually for there to be an increased rate in sleep disturbances and sleep disorders. Too little sleep or experiencing sleep disturbances is actually associated with physical health effects, from decreased life expectancy and a range of physical health issues. So it's really important. But we're all individuals, and the amount of sleep varies from person to person and in our lifetimes. Most people, when you ask them, will say that they need 8 hours sleep. But actually, this may not be the case. So the most important thing to do is work out how much sleep you as an individual need. So some people may need closer to 7, others may actually need 9 hours sleep. So pay close attention to how much sleep you're getting when you're functioning at your best. So finding out more about your sleep and what the ideal sleep should be, and how you can follow some easy tips to improve your sleep, can make a real big difference to your life. So sleep across the life stage. So there's a wealth of evidence that exists to say that sleep is actually crucial to our well-being, both to our mental and physical health. Getting enough sleep, and that's sleep of a high quality, is just as important as being physically active or eating well. So not getting enough good quality sleep can affect all areas of life. And sleep issues are often accompanied by low moods, so feeling anxious or really feeling fatigued as well. So you can't concentrate on work or relationships and other social aspects of your life. However, nearly all of us have had our sleep disturbed in the short or longer term, so it can be disturbed for many reasons. For example, if you're feeling anxious, you can have trouble falling asleep, and you can actually wake up earlier than you'd like. Changes to your normal sleep pattern, like jet lag and shift work, can disrupt normal sleeping patterns and confuse the difference between day and night. Alcohol and drug use can also change the body's signals as to whether we feel tired or not, sometimes thinking that we have more energy than we actually do, or making us sleep too much. Interestingly, insomnia doesn't always mean a shorter amount of sleep in total, but it can mean people who experience insomnia have frustration when they fall asleep, or they have problems staying asleep. Their total amount of sleep can actually be within the normal range, and yet they can still experience tiredness and frustration. So previously, there wasn't a great deal of research on the menopause and sleep, and this is fast changing as research is now more focused on the social, mental, and physiological changes that happen during perimenopause and menopause, and postmenopause as well. So we'll get on to have a look at some of these issues now. So in perimenopause, which can be up to 5 to 10 years before you experience the menopause itself, and during the menopause, many women experience trouble getting to sleep or staying asleep. And this can be accompanied by hot flushes, which can cause you to wake up more in the night, as well as things like restless leg syndrome, so nocturia, so getting up in the night to pee, and sleep disordered breathing, such as obstructive sleep apnea. Sleep apnea will be discussed a little later in this presentation. Sleep disturbance is a really common complaint, and experts argue over the different reasons for this. Vasomotor symptoms, so those are hot flashes, night sweats, heart palpitations, amongst others, can really disrupt your sleep. So they're also changing hormone levels and circadian rhythm changes. So your circadian rhythm is a natural patterning of how you sleep over a 24-hour period, and that's influenced by the amount of light you see and associations between day and night. So you may also be experiencing mood disorders around menopause around this time, and there may be a number of lifestyle factors which can disorder your sleep. So some of the things that can help alleviate vasomotor symptoms are wearing lighter clothing or layers of clothing and turning down the central heating, sleeping in a cooler room or using fans. I think there's often a misconception that hot flashes can seem just feeling temporarily very hot, but actually it can be extremely uncomfortable feeling. Some people have described it as feeling a boiling hot stone in your stomach and feeling uncomfortable all over your body. So it's something to be taken seriously, and it can have a serious effect on your sleep. If the problem is persistent with your sleep or you feel you need support with it, professional support may be available via your GP. There are also a series of resources that might be available and that we link to in this webinar as well. The hormonal treatment that are available, and also lifestyle advice and behavioural modification, and advice on those may be available via your GP. So children often have sleep problems too, and this might come as a surprise to many people. However, it may become a particular surprise to people with a baby to learn that babies actually sleep more than adults, but in a very different pattern. So infants have a very different sleep pattern and sleep in much shorter periods. But once they establish the difference between day and night and sleep for longer periods, there are certain things you can do to help older children with their sleep. So Great Ormond Street have published an advice at every age guide, which is referenced in the resources that go with this webinar. And there are plenty of things you can do to look after the sleep health of your children. So if your child does consume caffeine, which may seem a strange thing to say, so it's not just in tea and coffee, but it's in high concentrations within energy drinks as well. Try and limit this after 12 p.m. So caffeine is a stimulant and it can prevent sleep. Even if your child isn't sporty, getting some form of exercise in the day, such as a short walk outside, can really help them feel tired at the end of the day. So it's not just about nighttime routines and so on, it's about your behaviour during the day. When it does come to nighttime, your child's sleeping environment shouldn't be too stimulating or exciting and should be somewhere where they feel safe and secure. So if you can, and if you've got space, keep toys in another area of the house or adjust the bedroom lighting to your child's preference. So some children may prefer a nightlight if they're scared, or others may prefer total darkness. Having a recognisable bedtime routine that's familiar and predictable can also help your child recognise and respond to bedtime and pattern their behaviour. Also, things like going to the toilet just before beds may help nighttime interruptions or even help bedwetting. Limiting electronic devices such as phones and tablets that emit a blue light which tells your brain that it isn't yet nighttime and can interfere with sleep. So limit the usage of these with your children. Easier said than done, I realise, particularly in the evening and just before bed, and try and take them out of the bedroom if at all possible. There are, in fact, a lot of myths around sleep needs for teenagers. So there's good evidence to suggest that teenagers need more sleep than people later in life, and that a shift in sleep timing is found in teenagers across the world and a lot of different cultures. Whilst the reasons for this are still debated, some experts suggest that this is the result of biological changes. Sleep routines are no less important for teenagers, and sleep habits can continue to influence habits later in life. So try not to give your teenagers hand-me-down beds. So if it's the mattress quality, if it's not good enough for you, it's likely not good enough for them either. And there'll be some more helpful sleep advice that's applicable for all people later on in the webinar. But around this time, exams and other stresses can cause difficulties in sleep for teenagers. So encouraging exercise, encouraging something other than schoolwork, so socialising and relaxing is also really important. So sleep later in life. So the quality and quantity of your sleep can change a lot as we age. So not just coming through menopause, but in later life as well. People can wake up more, they can sleep less deeply and wake up a lot earlier than they used to. This isn't necessarily a sign of a sleep disorder or problem, it can just be a normal part of aging. However, some medications can also cause some sleep disturbances as well, so that's something that's important to think about. However, persistent sleepiness in the day is not a part of normal aging, and if it causes disruptions to your lifestyle or decreases the quality of your life, then it can be worth trying to do something about. So people with prolonged sleep problems have a higher risk of falls, so obesity, dementia, depression, and so on. And so it's important for a number of different reasons. So sleep and shift work. So shift work is very common in the UK, and it's a number of key industries such as healthcare, transportation, agriculture, and factories, and then also in some service industries. So it can disrupt what we were talking about before, so your circadian rhythm, so the physical, mental and behavioural changes that are patterned over a 24-hour period. And daylight is particularly responsible for these changes in circadian rhythm. So if you work during the night, you may not be exposing yourself to the normal amount of daylight. So link exists between shift work and accidents. Also things like type 2 diabetes, weight gain, coronary heart disease, stroke, and even cancer. The relationship between shift work to these diseases and accidents mimic those with insufficient sleep. So even if you're getting a good few hours in, it is like having insufficient sleep overall. Fortunately, there are things that can be done to help employers pattern these shift patterns for individual workers, so that the transition between shift patterns can be helped. So not a too rapid a change. And it's also important for employers to understand and accommodate people with sleep disorders. So it might be something that's important with pre-employment checks and so on. And also to schedule rest breaks, particularly to decrease the number of accidents travelling to and from work. Actions can also be taken to avoid driving whilst tired, such as employers paying for cab fares or ensuring safe routes to work. I'm now going to hand over to my colleague Alex, who'll talk a little bit about sleep and mental health, and also a number of things that you can do to improve your sleep.
Hi everyone, I'm Alex Robinson, a Programme Support Officer in the Public Health team at Birmingham City Council. I'm going to start by talking to you about mental health and the impact of that on sleep. And then I'll discuss some easy techniques that you can use to take care of your sleep health. So, anxiety can cause a number of sleep problems, and a vicious cycle can develop, as when your sleep is disturbed, it may make you more anxious. Telling someone who has anxiety to relax can feel like the equivalent of telling someone who is sad to cheer up. However, there are a broad range of resources and relaxation techniques, like mindfulness, that you can use to help with anxiety. Depression and seasonal affective disorder may also affect your sleep in a number of ways. Some people can oversleep and feel a lack of motivation to complete everyday tasks, whereas others may experience bouts of insomnia. You can watch the mental health webinar in this series and go to the accompanying webpage for more information and advice. Next is a video about some things which may help if you're struggling with your sleep.
So there are a number of things we can do to improve our sleep. We need to prioritize it. Don't cut corners. Figure out how much sleep you personally need. There are individual differences in sleep requirement. It's important to think about when is the best time for us to sleep and to wake. And don't be frightened to experiment with that. Go to bed when you think, I'm tired, I'm sleepy, I'm ready for sleep. And once you've got those timings in your mind, then try to get them into a good habit. So that becomes your regular schedule. It really helps if you're on a wind down curve some while before you go to bed, rather than closing the laptop and jumping into bed and then being annoyed that you can't get to sleep. Because you're not really well prepared if you do that. And lots of things will still be on your mind. So if you've got loose ends, things you're thinking through, write them down. Think about them tomorrow. Put them to rest. And having the bedroom environment ready as a comfortable place for you to sleep. Don't drink too much caffeine. Don't drink too much alcohol. It's a little bit like the Ministry of No Fun, I'm afraid, but it's preparing yourself for a better night's sleep. When we think about the relationship between exercise and sleep, exercise is a good preparation for feeling fit and healthy. So absolutely, exercise is valuable.
Some of the things that I found helped me sleep was getting yourself a routine, finding things that relax you.
You've got to turn away from the TV, find something else, look at a book. You've got to make your bedroom your den of loveliness and softness. So you've got to remove as much work that overstimulates you, anything that makes you unhappy. When you look at something and go, I don't like that, don't have it in your room. Only have things that make you feel good about you.
At the end of the day, as I say, just those short little things of what you find relax you really help.
Okay, so now I'm going to talk to you about how diet and exercise can help your sleep health. There are a range of changes you can make to your daily habits that can benefit your sleep. Regular exercise, especially early in the day, can help you sleep at night, even if this is just going for a short walk in the morning. However, it's best to avoid exercising late at night before bed if possible. Exercise can also help with weight loss, which can help to reduce the risk and symptoms of some sleep disorders like sleep apnea. Small changes to your diet can also have a significant impact on your sleep. For example, caffeine is a stimulant that can prevent us from sleeping, so limiting caffeine intake by not drinking coffee or energy drinks after 12 p.m. can make it easier to get to sleep and stay asleep. It can also be helpful to avoid spicy foods and large meals before bed. Perhaps try eating earlier in the day. Reducing alcohol intake and quitting smoking can also be beneficial. Some medications can also affect your sleep as a side effect, so it's important to talk to your GP and ensure you're on medication that works for you. Okay, so now I'm going to talk to you about sleep hygiene and having a healthy sleep environment and how that can benefit your sleep health. Maintaining a comfortable sleeping environment and practicing good sleep hygiene can significantly improve our sleep. You can maintain a comfortable sleep environment by keeping the room cool. This can be done by turning down central heating, sleeping in a cooler room, and using fans. You can also create a restful environment for sleep. You can do this by making your bed as comfortable as possible and keeping electronic devices like your phone, laptop, tablet, or desktop out of your bedroom. Especially when working from home, having your bedroom as a distinct space for sleep and separate from work can establish healthy work and sleep habits. Sleep hygiene is simply practicing healthy habits that encourage higher quality, uninterrupted sleep on a regular basis. There are a broad range of good sleep habits you can develop. For example, maintaining a regular sleep schedule is very beneficial. It's important to have a regular bedtime, but it is sometimes surprising to people that good sleep begins in the day. Having a regular time that you wake up and ensuring that you get exposure to the sunlight in the morning can help set you up for a good night's sleep. It can help to avoid electronic devices before bed, and if you do use them, you can try using a blue light filter. If you can't sleep, it can help to get up and out of bed until you feel sleepy, rather than tossing and turning whilst thinking about trying to get back to sleep. You can also try to relax before bed. You could do this through guided meditation and mindfulness exercises. So now I'm going to talk to you about some more serious problems that you can have with your sleep. There are some more serious sleep problems for which you should seek medical attention. These include sleep apnea, restless leg syndrome, and narcolepsy. Sleep apnea is when your breathing stops and starts again while you sleep. The most common type is called obstructive sleep apnea. Sleep apnea needs to be treated because it can lead to more serious health problems. Symptoms of sleep apnea mainly happen while you sleep. They include breathing stopping and starting, making gasping, snorting, or choking noises, waking up a lot, and loud snoring. During the day, you may also feel very tired, find it hard to concentrate, have mood swings, have a headache when you wake up. So the main symptoms of restless leg syndrome are an overwhelming urge to move your legs. It can also cause an unpleasant crawling or creeping sensation in the feet, calves, and thighs. The sensation is often worse in the evening or at night, and occasionally the arms can be affected too. Some people can suffer from long-term insomnia or have acute insomnia, where they suffer from the following. You might find it hard to go to sleep, wake up several times during the night, lie awake at night, wake up early and find it really difficult to go back to sleep. You might also feel tired after waking up, find it hard to nap during the day even though you're tired, feel tired and irritable during the day, and find it difficult to concentrate during the day because you're tired. Your pharmacist or GP may be able to help if you have experienced severe sleep problems. Narcolepsy is a rare long-term brain condition that causes a person to suddenly fall asleep at inappropriate times. The brain is unable to regulate sleeping and waking patterns normally, which can result in excessive daytime sleepiness, feeling drowsy throughout the day, and finding it difficult to concentrate and stay awake. It can also lead to sleep attacks where you suddenly fall asleep without warning. So there's a broad range of national services that you can use for support on the topics discussed today. The contact details for these organisations, as well as other resources, will be shared alongside this video and on our website. Should you need more specialist support, some services may be available via your GP. If you're enjoying these sessions and enjoy promoting positive health and supporting your community to improve their health and well-being, and want to be more involved, you can volunteer to become a Boulder Healthier Champion. Boulder Healthier Champions are advocates for important health messages in Birmingham. They distribute this information into a wide range of communities and networks. Your role as the Boulder Healthier Champion will be to share the information into your communities to encourage and support health and well-being. We will support you through monthly themed webinars and tailored resource packs. We've previously covered physical activity and how it can be incorporated into our daily lives, as well as the benefits from increasing regular activities, even in small ways. This month, we'll be covering cost of living, and in November, we'll be talking about diabetes. If this is something you're interested in, then sign up today by either searching Boulder Healthier Champions Birmingham City Council or by clicking on the link when you receive this slide deck. So that's the end of the presentation. Thank you for joining us today. Have a nice day.